She has had a 17 years of ever-expanding clinical experience in applied integrative and functional medicine. She is Dr. Shikha Aggarwal. She is specialized in treating digestive issues and chronic autoimmune conditions. Her focus is on diet, lifestyle, and nutritional supplementation, along with various kinds of intravenous infusions as per patient's requirement. She is a certified medical toxicologist as well, founding and certified member of the Ozone Forum of India, certified member of the Australasian School of Nutritional Medicine. She's an associate member of the Indian Institute of Functional Medicine USA. She has done her AFMCP as well. She's going to talk on detox strategies to balance your immune system in cases of an autoimmune condition. Yes, Dr. Shikha, please go ahead. The stage is yours.
Hello, good afternoon, everyone.
Good afternoon.
It's now afternoon of the third day of the conference, and a lot of knowledge has already been imparted. And continuing the trend right now, my topic that I'm going to talk on today is detox strategies to balance your immune system. My talk is going to be mainly focused on small practical things that you can do at home and less on biochemical scientific background of all of this. So let's get started. Let me share my screen. How do I allow? Okay, I just have to change some settings, it seems. I don't know what's going on.
Should I share my screen and help you with that?
No, I made some changes in the presentation.
There will be a pop-up menu there will be a taskbar where there is share screen.
No, it's saying I have to do something in my firewall options or privacy options. I have no idea. Zoom. Okay, it's done. Okay, I have to quit and restart. I hope that's okay. I'll have to quit and restart Zoom. Just a second.
Okay. Yes. Sorry for the interruption. Meanwhile, we have Dr. Praveen Saxena, Dr. Vivek Kadambi, Dr. Anish Musa. They are going to talk. So they are our next speakers basically. And Dr. Vivek Kadambi and Dr. Anish Musa sir are going to talk on the thyroid and women health. We also have Siddharth Goel. Please stay tuned for some amazing insights on thyroid and women health. We are going to wait for the speaker for a period of 1 or 2 minutes, 1 minute. We can take up the questions, sir. Dr. Praveen.
I was answering, actually. I was answering to these people. And I think this is very pertinent questions what we have been, gastritis, how to differentiate gastritis from the cardiac issue. I think no doctor can be very, very comfortable. You need to just rely on the tests and all that. And it's basically more of a clinical correlate. But if somebody can do something called TROP-T test, and that will cleanse the diagnosis.
Thank you.
Apart from your 2D echocardiography.
Okay, it's up now, right?
Yeah. Yes.
Okay, all right. So let me make it full screen.
Thank you so much, Praveen, sir.
Thank you.
Thank you.
All right, so the topic, as I said, for me today is detox strategies to balance your immune system. So what's going on? Despite advances in modern medicine, today more than ever, people are suffering from chronic illnesses. And it's not just chronic, even the acute illnesses tend to stay longer. You know, the common cold that used to last for 4 to 5 days in good old days. Nowadays, if you get a cold, it's lasting for a minimum of 2 weeks, followed by another 6 weeks of hacking cough. That's kind of worrying, right? The other thing is the autoimmune conditions. 50 years ago, the chances of you getting an autoimmune condition was 1:1500. And today it is less than 1:5. So what's going on? What's happening? Before I go into that, immune system has been very broadly discussed so far. I just want to put it in 2 words according to a layman language. Our immune system is a system that is the purpose of the immune system is to defend our bodies against the external antigens. But when the same immune system starts to act against your own cells, that's when we call it an autoimmune condition. And it can act against basically any organ, your joints, your muscles, your skin, your heart, anywhere, any organ can be affected by that. That's why, you know, in our family, at least one person is suffering from a chronic health condition. Dr. Bisalam had very beautifully said that any chronic inflammation, any acute inflammation that tends to last longer becomes chronic and turns into autoimmune. So raising or balancing one's immune system has become the hot topic these days. I recently had treated a patient. She had come to me with severe flu-like symptoms, you know, which means she was having fever on and off, poor sleep, brain fog. She had a lot of body aches, myalgias, arthralgias, and literally not able to function anymore. She has had these symptoms for like 4 to 5 years, and they were just getting worse over the time. I did a thorough examination, a full consultation, and I found out that she was actually a perfect case of toxicity, which caused an autoimmune or immune disorder in her system. And live blood analysis confirmed that her white blood cells were very lazy, very inactive, considering that she was getting so much fever on and off. Her neutrophil count was pretty low. So what were the toxins that were actually creating problem in her? The first toxin I want to talk about is stress. Stress, personal or work related. Stress is one of the major reasons for our immune system disorders. Heavy metals and chemicals. She had tattoos all over her body. The heavy metals have been discussed as well. But the tattoos, what do tattoos do? Tattoos, they release micro amounts of heavy metals slowly over the time, which go into our system, into our organs, and create autoimmune conditions. She had a vegan diet, but her vegan diet was very imbalanced. A well-balanced vegan diet can actually help you treat conditions, but if it is imbalanced, it leads to malnutrition. Moreover, she had no access to organic foods or healthy foods. So her food was ridden with pesticides and herbicides. The fifth factor that she had was she had a chronic Lyme's disease. She was EBV positive, and she had pretty much a lot of gut dysbiosis because she had taken antibiotics over the years, because wherever she went, she was prescribed antibiotics. So she was having all the factors that actually affect your immune system. But there is one more factor that I want to talk about that literally kills your immunity, and that's fear. What does fear do? Fear sends your body into a state of, in a frozen state, and the body forgets how to respond. Acute fear can cause heart attacks. Chronic fear takes the will to live away. It stresses your heart, your immune system, and as your consciousness is actually on the verge of escaping a body ridden with fear, this body can't survive. You don't need to be infected by a virus or cancer to die. Fear will do the job. So it's very well said, considering all these factors that I mentioned: toxins, physical, emotional, mental, are the primary drivers of disease. And we are what we eat, drink, breathe, touch, and can't eliminate. It's very, very important we address each and every factor whenever we are dealing with detoxification and balancing our immune system. Now, when we look at this picture, what does this picture show? This picture shows a guy being pumped up with all these chemicals. The chemicals are actually cosmetics, right? A woman who wakes up in the morning, from the time she wakes up to the time she goes to the office, she is exposed to around 150 chemicals in the form of toothpaste or in the form of shampoo or food sheets, cosmetics she puts on. 150 chemicals already in first thing in the morning. And throughout the day, it can be tens and thousands of chemicals that go into her system. This is kind of a short list of all the chemicals that can be in the body. I want to talk about a few things that actually at the moment are a present trend post-COVID, which are adding a lot of toxicity to our system. One is the sanitizers and regular soaps. What do? The claim is the sanitizers and regular soaps or disinfectant soaps, they kill 99% of bacteria. Now, what we need to remember, our body is 100 trillion bacteria, but only 70 trillion cells. So it's safer to say that you are more bacteria than your own cells. In such a case, killing most of the bacteria on your skin will disrupt natural immune response of your bodies. And not just the sanitizers and soaps having these disinfectants is the one major other factor, this triclosan that causes. Triclosan, which is the major ingredient of all of these disinfectants. It is altering your hormones. It actually creates antibiotic resistance. So you are taking all of these sanitizers, etc., to kill germs, but these germs then come out to be more and more antibiotic resistant, thus harming your system. FDA actually has in 2017 declared that triclosan is not a safe and effective chemical that should be used in all of these antiseptic products. Heavy metals is the next thing, right? A lot of doctors have already spoken about heavy metals. I won't go into detail. The only thing that I want to mention, heavy metals, they come from different sources. They're in vaccinations, they're in utensils, they are in a lot of beer cans, or so many things carry heavy metals, food, everywhere. So what is it that I want to talk about heavy metals? Heavy metals, they are the deep-rooted cause of all these unexplained illnesses, autoimmune disorders like Parkinson's, Alzheimer's, diabetes, heart problems, kidney problems, food sensitivities, etc., etc. The major impact they have also on the immune system, which is mainly by lead and mercury. Our white cells get paralyzed in the presence of lead and mercury and cannot function. I have seen patients where a case of chronic candidiasis cannot be cured till I have chelated that patient of heavy metals. Or a patient who has a lot of parasites in the body. Parasites just keep coming back. You deworm, the parasites will come back after some time. Deworm, parasites come back. I chelated that person and I have been able to get rid of these pathogenic organisms from the system. A case of a chronic cough where from constant irritation in the throat, it just didn't go till I chelated that patient and removed heavy metals. So how do heavy metals play a role in this? How do they help these microbes? Bacteria, viruses, and fungi. These are very intelligent organisms. These bacteria, viruses know our white cells get paralyzed. Our immune system is rendered ineffective if they concentrate heavy metals in their bodies. Or they form a film which is called biofilm, which is carrying these heavy metals, so that immune system or immune cells just cannot attack them anymore. This is how these microbes survive chronically in the body. So if you want to really get rid of all of these infections and you're not able to get rid of it through other means, through regular means, then you need to look at heavy metals in your system. These takeout boxes, they have become so common these days. I'm sure there's a lot of people sitting around even now having a takeout in their hands. These takeouts, the 2/3 of these paper takeout containers, they contain elevated level of fluorine, which meant that they were probably treated with PFAs or Teflon coating on them. This Teflon coating is a transparent and flexible fluoropolymer, which has a low coefficient of friction. And it's flexible, it's heat resistant, and it is actually used to coat a lot of things that need heat insulation. Teflon is a reproductive, elemental, developmental, liver, kidney, immunological disruptor. And it also is causing a lot of hypothyroid cases these days. You see these aluminum cans? We are producing about 200 billion aluminum cans every year, and 6,700 cans every second. I talk about these cans not just because of the aluminum coating in them, but also these cans have BPA, bisphenol A. Bisphenol A is again a disruptor, it's an endocrine disruptor, and it causes male infertility, and also breast cancers and prostate cancers, a lot of health issues. Electromagnetic radiations. We are listening to this conference online all over India, all over the world. It's playing right now. It's because of the technology. We love technology. We have been in touch with it. Over the years, the technology has advanced from 2G to 3G to 4G, now 5G, right? So what are these EMF is, okay, we are happy with technology, but the electromagnetic radiations, these radiations, they are released in pulsed form and they are absorbed through our body surface, particularly through the head region. They have both thermal and non-thermal stress they create, but the heat produced isn't that damaging. It's non-thermal stress, which creates, it releases certain ions, which damages your plasma membrane, your cell membrane, the receptors on it. So your body is not able to recognize self from the other. That's how your autoimmune conditions rise. There was a study which was done or published in July 2017, where they tested the effect of 2G and 3G cell phone on the development of liver of chick embryo. So it's not just liver, actually, it's also kidneys. According to this study, what they found out that exposure of developing chick embryo to 2G and 3G cell phone radiations caused structural changes in liver, in the form of whatever this is scientific, and so it literally changed the structure and destroyed the detoxification ability of liver. And not just liver, kidneys also. In simple terms, we can say 2G and 3G had wavelengths or frequencies which matched your liver and kidney, and thus decreasing the detox capacity. Between 2006 and 2011, whenever I had patients, they could come with any serious health issue to me, and just giving them deep cellular detox in the first 3 weeks, a lot of them would just improve quickly. But then over the time, I saw when the Android phones came into use, 2G came, 3G came, then 4. What happened was the body's ability to detoxify went down. People were just not able to throw out toxins. I had to work on the liver and I had to work on the kidneys before I could actually go into a deeper cellular detox with them. So, and now we have 5G. 5G, what does 5G do? 5G knocks out oxygen from your red blood cells. It creates a state of hypoxia in your tissues and consequent health problems. Dr. Millie perfectly explained how hypoxia is the root cause of so many health issues. So people are falling sick so often now. Every little change in weather, little change in your situation or your environment, you have a cold. Why is that? This is literally because of 5G. A lot of cases which we call COVID these days are actually caused by 5Gs. So we have to be careful about the radiations. The radiations cause a lot of long-term health issues in us. So what's the solution? How shall we save ourselves? How prevent our immune systems from going down? There are several things that we can do about it. First and foremost is, it's very common sense, you reduce exposure. You use organic foods, you use natural products, you stop using a lot of antibiotics and painkillers. You use wires instead of Wi-Fi and Bluetooth wherever possible. Use a wired headphone instead of the Bluetooth headphones. Carry your handphones in a handbag, not in shirt or pant pockets. Turn your Wi-Fi off at night. Leave your cell phones out of your bedroom. Grounding is another factor that I want to add here. You can do earthing. Walk bare feet on the ground, in the grass, regularly for half an hour every day. It allows the radiations to be sucked out of your body into the earth, just like we do earthing of our house. The next step after we have reduced exposure is to detoxify. Now, this is where the strategies to detoxify come in. Strengthen your body's ability to detoxify. I talk about not just detoxify, I talk about strengthening your innate ability to detoxify. That's very important because you can detoxify yourself considering how toxic our environment is. We're not going to stay detoxed. We will retox again and again. So it's very important for us to improve our ability to detoxify. How do we improve our ability to detoxify? We improve it by cleaning our organs of elimination. Our digestive tract, kidneys, liver, skin, lungs, and lymphatics. Let's look at them one by one. Cleaning up your gut. Gut is the first organ that needs to be cleansed. Our digestive tract is 21 feet long. It has a surface area of two tennis courts, not table, 2 lawn tennis courts, you can say. 70% of your immune system is in the gut. And that is why majority of the autoimmune conditions begin in gut. Your gut is also responsible for neurotransmitters like serotonin hormone that keeps you happy and energized. The same gut also houses multiple microbes of all different kinds. The quality and diversity of these microbes is one of the main drivers of your immune system. So if there's only one thing that you're going to do about yourself, clean your digestive tract. So how do you do it? The first thing you will do, change what you put in. So there are different strategies to do it. You can go on fastings of different kinds. You could do 3-day, 5-day, 10-day, whatever fast you like, if your body allows it, if your healthcare practitioner agrees to it. Not everybody is suitable for fasts. The second thing, after fasting is you start to avoid foods that you intuitively know your body does not like or does not want. We know which foods our body does not want. We just stubbornly don't want to agree to that. We don't want to listen to ourselves. So if you actually listen to yourselves, you will know. Or you could go on a general diet where you regularly follow a diet where you take out the inflammatory foods like wheat, dairy, sugar, junk, refined, processed foods, or the cold drinks, the soft drinks, highly oil, very oily, deep fried foods, etc., etc. So this is something you can do on a regular basis to clean yourself. I personally like to put my patients on a no-grain diet or an anti-inflammatory diet for 3 weeks to 3 months. In fact, using elimination diet protocols, I have been able to treat a lot of chronic autoimmune conditions, at least bring them to a baseline health level where they can live their life well without having the, totally debilitated, they can't function anymore. Eat fresh as much as possible. This is really, really important. Frozen foods have become very common. We are eating takeouts from the restaurants. Restaurant food isn't fresh anymore. We are eating packaged foods. We go and buy stuff from the shelves market and we just use microwave, heat it up and eat it. This has become very common in nuclear families where everybody's working. Fresh is important. Fresh carries enzymes, fresh carries fibers, fresh carries nutrients that will help you clean yourself. So this is what you change when what you put into your system.
We have 5 minutes to go. Yeah.
Yes. How can it be?
5.
What's the time now? Actually, I started 10 minutes late, right? So you have to give me 10 more minutes.
Yeah.
So you clean your digestive tract. Early morning on an empty stomach, there are a lot of home remedies, everybody knows. I like to use psyllium husk on an empty stomach in the morning. Psyllium husk acts as a toothbrush. You take empty stomach, a lot of people for constipation like to you drink it with milk at night. But what I prefer is taking it in the morning because it's literally a toothbrush for intestinal lining. And then you need to deworm yourself. You can use natural remedies for that. There's one recipe that I want to give that you could use at home to deworm yourself. You could use a mixture of cilantro, cloves, coconut flakes, garlic, pumpkin seeds, turmeric. What you do is you take all of these ingredients together, blend them all. You take 1 teaspoon of this mixture with 1 tablespoon of aloe vera juice 3 times a day just before meals for 5 to 7 days. This can help to naturally deworm. And it's not just deworming we're doing, we're actually killing larvae. We're actually trying to kill fungus as well. We're not only focusing on parasites here. But there's a caution. You can use this remedy at home, but there's a caution. People who have high pitta or people who have inflammation in the stomach, they must not use it without guidance. The next that you could do is you can regularly use cleanses like enemas and colonics to decrease the waste load in your gut. Once you have cleansed your gut, once you have cleaned, you have changed the diet, you have removed a lot of stuff. Now we come to the part of replenishment, re-inoculation. Our intestinal bacteria play a major role in biotransformation and detoxification. Detoxification of a lot of these toxins, which chemicals, xenobiotic, which actually act like hormones, from the milk or from different kind of dairy products or whatever else we take in, plastic waste and all of that. The bacteria also play a role in detoxifying you. So natural ways to improve your bacteria is kimchi, kombucha, sauerkraut. You could use Rejuvilac. In North India, it's kanji. You could use a lot of different natural probiotics. And you can also use actually probiotic capsules wherever it is needed. So after we have cleansed the gut, we need to come to cleaning your kidneys and your liver. So what are the signs usually? Not always the signs are visible, but sometimes for people, it is good to know when their kidneys and liver are toxic. So what are the signs? What will tell you that you have a toxic kidney or liver? You have nausea or vomiting often, or you actually get nauseous after taking supplements, not very hungry, you have sleep problems. If you're waking up between 1 and 5 in the night, you have some issue with liver and kidney. Fatigue and weakness, muscle cramps, swelling in feet and ankles, persistent itching, high blood pressure that is difficult to control. For liver, there are some other signs. You have caffeine intolerance, you're feeling sick after eating garlic, you have adverse reaction to sulfites, you intolerance to strong odors and perfumes, even one beer is giving you headaches. So these are pretty common in a lot of people. And if you have any of these issues, your liver is congested and you must clean it up. So how do we go about cleaning kidneys and liver? I'm going to talk about what you can do at home to clean your kidneys and liver. In general, a lot of water, decreasing salt intake, don't take phosphate-rich drinks and anti-caking agent salt like free-flowing salt. Eat a lot of leafy green vegetables. Beetroot juice is a potent cleanser of gut. So for example, if you're doing you take out three weeks for yourself and you're doing a cleanse at home, you can first do the diet and start with gut cleaning. Then you can do a kidney cleanse. And in kidney cleanse, you start with 1 cup of beetroot juice every day. Along with that, you take parsley water. You take 250 grams of parsley, you boil it in about 1800 ml of water, and for about half an hour or so. Then you take 1 cup of this water 3 times a day for 3 to 4 days. This water must be kept in fridge. Parsley helps to flush out toxins from your kidneys. Similarly, you could do some things for your liver cleanse. Once you've done the kidney cleanse, you come to the liver cleanse. In liver, we have to do two things. We have to increase the flow of bile from the liver. We have to support the process of detoxification in the liver. Bile is not only for digestion of fats, bile also carries toxins out of you. So how do you increase the flow of bile? You increase the flow of bile by using bitters, bitter herbs, bitter foods, dandelion, milk, thistle, turmeric, etc. And you support the process of detoxification in liver by using cabbage, cruciferous family foods. Egg yolk is very important. Please remember, the fat that egg yolk causes or raises your cholesterol is very old. It's old-fashioned. Egg yolk does not increase your cholesterol. Egg yolk has choline in it. Choline is very important for supporting the detoxification in liver. Egg yolk also helps with the supporting methylation processes in your liver. Any liver detox is incomplete without B vitamins. Whenever you are cleaning your liver, you must take B vitamins. And if you want to go really deeper, but with the help of a physician, you can do coffee enemas, you can do liver flush as per the protocol from Andreas Moritz. And what can you do at home without having to take any much guidance? You could drink dandelion tea, take a week out again, drink dandelion tea once or twice a day, eat bitter foods, 1 cup of grated beetroot with a spoon of olive oil on an empty stomach for 1 week. That will help you clean your liver. You have cleansed your gut, kidney, liver, but don't forget your skin, lungs, and lymphatics, because microcirculation is as important as any other organ for elimination. So steam saunas, FIR saunas, scrubbing your body in showers, swimming, trampoline, everything's important. And breathing exercise like pranayama or Wim Hof breathing, you need to clean your organs fully, completely. Once you have done all of this cleansing, you must go on a diet. You must follow the diet to keep the detox going. So proteins and plants of all different colors. This was discussed already. I'm not going to go into details, but we need fresh foods. And there are 4 basic questions I ask people to ask themselves when they are choosing the foods they're going to eat. Am I getting a variety of foods? Am I eating the rainbow of natural whole food-based colors? Am I focused on the quality of the food? Am I aware of how my body is responding to the foods? The last question is very, very important. So what you could do in the last question, actually, you could check at home. You take your pulse before you start eating. Then after a minute of having one particular food, you check your pulse again. If your pulse rate has gone up by 10 or more, then you are definitely reacting to that food. And what you could do, you could eliminate that food for 3 weeks minimum and do a kind of a cleanse, then check again if there's any shift in it or not. So this is basically what is needed when you're detoxing yourself is a change in attitude of how you approach your diet, how you approach your lifestyle. You need to change yourself from a spectrum of toxicity to the spectrum of detox when you choose your diets. Now, this is the last thing that I want to say. You have done everything to clean yourself, but you are staying awake whole night, dancing, partying, watching movies, and blah, 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 whatever you're doing. You're not sleeping on time. Remember, you will not detox properly if your parasympathetic is not active. If you have a sympathetic overactivity, you are not detoxing. Parasympathetic system is needed for repair and regeneration, for strengthening your immune system. So you have to activate parasympathetic system. Now, what happens is if you are, for example, you have done detoxes, but you haven't changed your lifestyle. 2 months later, you're going to be back to this square one. So parasympathetic activation is really as important as anything else. How do you activate parasympathetics? You sleep on time, you meditate, you de-stress. And how do you de-stress? One way I tell my patients to de-stress is take 1 hour out every day, where you forget your family, you forget your work, forget husband, wife, children, everything, you just forget everything. In that 1 hour, you just be yourself. Dance, sing out loud, do whatever you want to do, but spend that 1 hour with yourself every day if possible. That will help you activate your parasympathetic, and thus it will keep you detox, it will keep you healthy, it will keep your organs of elimination better. So that's all I have to say. I think I have given some information and tips that you can follow at home. Thank you.
Thank you so much, Dr. Shikha Aggarwal. There was one question in the chat box that if some person is not eating eggs, what are the other things that in the source of protein that the patient or the person can take if he's
Well,
an
it depends upon are they vegetarian or non-vegetarian. If they're totally vegetarian, and because if they're not eating eggs, maybe they're not eating non-vegetarian foods as well. In those cases, then they can balance the vegetarian diet in the. You mean you're asking about source of proteins or source of
proteins in terms of detoxification? Yes.
Proteins. So I think for that, green leafy vegetables play a major role because they do carry proteins as well. And they do have, so all different colors of foods and all different kinds of vegetables, especially green vegetables, they will be important. If a person is able to handle beans, some kind of beans, chickpeas in the form of hummus, and then having a more basin basically, that is also rich in proteins. So for vegetarians, it becomes difficult. I then recommend taking protein powders. You could take pea protein powder, you could take hemp protein powder, then you can take spirulina. So all of these, moringa is very rich in proteins. Quinoa is a grain which is rich in proteins. So a lot of people can then choose different foods and make sure something or the other is added. And if soya bean is of organic source, and if you're not allergic to soya, then taking soya bean based substitute, tofu, miso, tempeh, the natto, these are also very, very good sources of proteins.
One last question, that is, what do you start in patient who has tattoo? So what do you do? The first thing that you do?
It's very difficult because tattoo is going to continue to leach out heavy metals. And these people, again, first thing to be done is, again, what I just suggested. You have to decongest them first. And then once I've started decongestion, I will start chelation on them. But the chelation process in them is almost like never ending. They will have to regularly take chelation almost all their life, or they have to work on removing tattoos from their bodies.
Thank you so much, ma'am, for sharing out your knowledge